So today we'll talk about the ECG criteria for the ST elevation MI. See, this acute MI is divided into two types. One is ST elevation and one is non-ST elevation. So when it is called as ST elevation, the patient will present with the symptoms of chest pain. On ECG, if you see the ST elevation more than 1 mm in two contagious leads, especially in lead V2 and V3. In case if it is a female, more than 1.5 mm, and if it is male and the age of less than 40, if it is if you find more than 2.5 mm of ST elevation in lead V2 and V3, and as well as age less than 40-year-old, like more than 40-year-old, then the ST elevation should be more than 2 mm in lead V2 and V3. So these are the criteria for ST elevation. So any change, any ECG changes with patient having chest pain symptoms and along with the ST elevation with more than 1 mm in two contagious leads, we can look for the criteria for ST elevation. And the next thing is we can go for thrombolysis or PCA if needed. The main content of the video is the types of MI. See, usually it is divided into 5 types: type 1, type 2, type 3, and type 4, A, B, C, and type 5. So type 1 is because of sudden plaque rupture. Type 2 is because of oxygen supply demand or very vasospasm. Under type 3, the patient is dead, maybe due to MI, but trope is not available, then it is confirmed on autopsy. Coming to type 4, type 4A, it is due to PCA related, and type 4B, it is due to stenosis, and type 4C, it is due to restenosis. In this case, the trope is 5 times more than normal range. Coming to type 5, it is due to CABG related, where the trope is 10 times more than normal range. So these are the types of MI where you can read about, and you should read about all these things, where the management will be differ in all these cases. So do read about the ECG criteria for ST elevation MI.